HIV and AIDS has been described as a multi-sectoral issue affecting adolescent and young people. In light of this, the AIDS Healthcare Foundation organized a youth dialogue session to discuss and address key issues affecting young people. Correspondent Lois Appa-Sambo has details.
A report by UNICEF shows that in Nigeria, out of the 7,600 new HIV infections recorded in 2021 amongst young people, over 6,800 were girls, revealing a great disparity between young girls and boys. The dialogue session, organized by AIDS Healthcare Foundation in Abuja, focused on the national HIV/AIDS response and strategies to prevent new infections and guarantee equal access for young people at high risk of contracting HIV. Country Program Director, AIDS Healthcare Foundation Nigeria, Dr. Iche Ijeze, who lauded government's efforts, said it is important that young people are involved in issues concerning them and allowed to speak in their own language.
There's an obvious decline, so there's been a remarkable improvement and a remarkable work and effort that has been done by all the relevant partners, including AHF as well, across all tiers of government. But then, despite these achievements, there are still areas that we need to focus on, and one of those areas involve the youth, adolescents and young persons, youth, pregnant women and children, and those are areas we need to begin to reprogram our efforts to. And so we're using this opportunity of World AIDS Day today, to 2022, to identify, to speak, let the youths now champion it. Let them be the ones to say what their challenges are, what their barriers are, and then we can hear from them firsthand.
Meanwhile, UNICEF Health Manager, Dr. Victoria Isiramen, revealed that Nigeria is targeting two major strategic plans to ensure zero new infections, zero stigma and discrimination, by sufficiently engaging young people and encouraging them to secure their place in building the nation.
In the age group 15 to 24 also, you also see such huge disparities. So if we invest more in girls, you secure the girl's future, you secure the future of our partner, you secure the future of a child she's going to deliver. So this is a call to Nigeria as a country. We are doing well. We have gone a long way, in the HIV response. We have good plans. Now we need to implement it.
Speaking on barriers, Deputy Director at NACA and lead Prevention and Social Behavioral Change Communication of the HIV National Response, Dr. Daniel Ndukwe, said some rural areas require special response as they have a high HIV prevalence rate.
Cosmos, whether that place is rural area, whether it is urban area, we focus on them. And then for the rural areas, we also work through already existing community structures to reach the people, because every community or society has their own peculiarity. So we take that into plan as we plan for them.
The theme for the 2022 World AIDS Day, Equalize to End AIDS, is aimed at addressing the inequality in terms of accessing treatment and care for HIV. Lois Appa-Sambo, ASO Television News.